Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, October 14th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief, and the General Manager of the Emergency Operations Centre, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. And while it seems like a long way away, I want to say thank you now to all the residents who followed public health advice over the Thanksgiving weekend. It was different for your family as it was for my family, but it was for the greater good to help us get over this long nightmare faster. Your sacrifice will make a difference over the coming weeks as we work to make sure that the numbers of COVID-19 cases in the city start to go back in the right direction and all that goes with that in terms of hospitalization and impacts on crucial things like schools and the elderly. I know it's very hard and very frustrating to see public health restrictions return when we had made such progress in confronting this virus. Many cities around the world are facing this challenge as well, and if you watch the news, as I do very carefully, you will see that many major global cities like Toronto have received the same health advice that we have and have taken the same actions that we have. The public health advice at this time is clear, and that is what we are following in order to keep schools open, protect people in our long-term care homes, and fight the resurgence of this virus. I also know the devastating impact that the closure of indoor dining for 28 days is having on restaurants in Toronto. I've been in touch with many of them personally, both before and after, and talking about the previous closure and the great challenge that that posed for them. I have personally worked very hard to help secure federal and provincial financial support for these businesses and for their workers, and I thank both the federal and provincial governments for stepping up. And as we've seen details of some of their programs, I can say that they are responsive to many of the things raised with me and with them by the industry, and I hope these programs are going to turn out to be as helpful as I think they can be. We are working as a city to help where we can, recognizing we don't have anywhere near the resources at our disposal as the other governments, but we can help. Today, Destination Toronto, in partnership with the city, launched To Go Toronto, which will help connect people with restaurants offering takeout, delivery, and patio dining. Starting today, residents can once again visit togotoronto.com to find great restaurants from your own neighborhood or across the city that provide safe takeout, delivery, or patio dining. Restaurants are encouraged to sign up for this site for free by going to togotoronto.com and clicking Add My Restaurant. We've also worked out a new partnership with the Toronto-based app Ritual to help restaurants. Today, I'm pleased to announce that the City of Toronto is extending its partnership with Ritual to launch Open for Business, a collaboration with Ritual and DoorDash to help local businesses across Toronto increase their commission-free online sales. As you may know, Ritual One is typically accessed by restaurants, bars, and food services, such as cafes, bakeries, butchers, and grocers. However, this new program, Open for Business, is available to any Toronto business that wants access to commission-free pickup and delivery. We know it is now more crucial than ever before for businesses to connect with their customers online. When we announced the first phase of our partnership with Ritual at the beginning of the pandemic this past spring, 1,211 Toronto businesses signed up for the commission-free Ritual One platform. With COVID-19 remaining a threat to Toronto's economy and to communities, this new program will continue to help local businesses keep their doors open while keeping their employees and customers healthy and safe through commission-free online ordering. Through this partnership, Ritual will provide its commission-free digital ordering platform, Ritual One, to Toronto businesses at no cost through the end of this year. So this includes waiving the setup fees, which are usually $99, and waiving monthly subscription fees, which are typically about $49 a month. All of these fees are waived for Toronto businesses thanks to Ritual. All Toronto businesses who enroll in Ritual One will receive delivery capabilities powered by DoorDash Drive, its fulfillment platform that powers direct delivery for any business. And, in addition, Toronto businesses will receive 2 weeks of free delivery from October 26th to November the 8th. All flat fee delivery fees will be waived for customers and local businesses to encourage customers to order directly from local businesses. And finally, any business that completes one delivery order on Ritual One powered by DoorDash Drive by December 31st will receive Ritual One for free through 2021, the whole of next year. Toronto businesses can learn more about Open for Business and enroll at ritual.co/Toronto. Businesses already enrolled in the city's Shop Here program, something we introduced earlier this year in conjunction with other partners, will also be eligible for this new program. Toronto independent businesses and artists can sign up for their free online Shop Here store at digitalmainstreet.ca/shophere. This is just one example of the many partnerships that we are engaging in with other orders of government, with nonprofit organizations, and with the private sector to provide the economic support and recovery assistance Toronto businesses need to get through this pandemic. It is partnerships such as this that will help Toronto businesses recover and rebuild stronger than before. And I want to thank Ritual, which is a Toronto tech success story, for developing Ritual One and partnering with us to help our local businesses, especially in the restaurant sector and food services sector, as we face a second wave of COVID-19. Ritual and DoorDash are examples of companies doing the right thing now to help businesses get through this. And the city is working on other ways to help the restaurant industry get through this 28-day pause. I want to just pause myself for a moment to thank the vast majority of restaurants who are doing the right thing and following, however hard it may be for them to do this, the public health advice and working with us to find a path forward. In fact, I'm having a summit meeting with them, some of the representatives of the restaurant and hospitality industries later this week. But I think we can help them too as residents of the City of Toronto by ordering from the local restaurants as often as we possibly can, online, for takeout, for delivery, or engaging in patio dining. One more important group who I really believe have to step up now in order to help restaurants are the partners of restaurants. And I choose the word partners quite deliberately in referring to landlords, insurance companies, and delivery companies. Yes, there is a moral argument which says that landlords, insurance companies, and food delivery firms should help because I thought we were all in this together. That's what we've been saying, and that includes restaurants and their customers being in this together. But you know, there's also a powerful business argument. If landlords don't help restaurants, and I know many have, but if landlords don't help restaurants even more, they will have no tenants who will be paying no rent. If insurance companies impose huge premium increases on struggling restaurants during a health emergency, they will have no client and no premium income when the pandemic is done. And if food delivery companies take huge commissions during a pandemic and a temporary shutdown, they will have no commission income afterwards from businesses that have closed down. I would urge the other delivery companies to see what DoorDash is doing in partnership with Ritual and follow their lead. Do something to help, no excuses. Like Premier Ford, I understand business. I came from there, and I know that Ritual and all these other, the Uber Eats and DoorDash and all these other food delivery companies are businesses. I understand that. But that's why I also believe it is right and necessary for, and just plain business smart, for landlords to do even more to help restaurants with their rent, for insurance companies to cancel big premium increases on restaurants during a health emergency, and for food delivery companies to suspend or dramatically alter commissions during the shutdown of indoor dining for public health reasons. That would be the sane, sensible thing for them to do from a business standpoint, and it would be an act of good corporate citizenship. You can never go wrong supporting your customers when they're in trouble. Finally, for today, I want to highlight the fact that the city launched its latest Toronto for All campaign yesterday, this one being focused on addressing anti-East Asian racism. The Toronto for All campaign has been in place for a couple of years now and has done a wonderful job, I think, of raising awareness of some of the racist stereotypes and other kinds of activities that still exist in our city, as we have stated quite straightforwardly. Since the declaration of the pandemic, there has been a rise in incidents of racism against all East Asian communities in Toronto, hundreds of thousands of people who have their origins in East Asia. According to the Chinese National Council, Toronto Chapter, and Project 1907, 26% of the more than 600 reported anti-East Asian racism incidents in Canada took place in Toronto since the declaration of the pandemic. To bring attention to the need to combat anti-East Asian racism in our city, the city has partnered with the Chinese-Canadian National Council for Social Justice and a coalition of community partners to develop a social media campaign under our Toronto for All umbrella initiative. This new campaign focuses on confronting harmful stereotypes and myths. It also challenges Torontonians to reflect on how they may be, consciously or unconsciously, participating in anti-East Asian racism and encourages them, individual Torontonians, to speak up to prevent racism when they see it. I am here to tell you emphatically something I know that you don't need to be told. That is that our Toronto must be a city for all. That's how we think, it is who we are, and it is how the world sees us. But we won't reach that goal, a city for all, by wishing it to be so. Racism and discrimination have no place in Toronto. I encourage all Torontonians to visit this campaign website, toronto.ca/anti-East Asian racism, to learn more about anti-East Asian racism in our city and country and learn how to be an ally. Every single day of every single year, we must stand beside and stand behind our fellow residents of Toronto when we see acts of anti-Black, anti-Asian, anti-Semitic, Islamophobic, or anti-LGBTQ behavior, just to name groups often the victims of this kind of behavior. It is all the same. It is abusive regardless of who they are, of people. It is discriminatory, it is hurtful, and it is hateful. Recent events tell us that we must do better, yes, in this city as well. In this city in particular, because it's where we live. The world expects us to do better in Toronto. We expect more of each other, and we so completely reject this when we see it elsewhere. So we have to make sure that we live up to the standards that we set for others and for ourselves. And it is past time for us to act as individuals and collectively in this regard. I would now like to ask Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I'm reporting 296 new COVID-19 cases. The new count brings our total cases since the pandemic started to 23,338. Today, 108 people in Toronto are in hospital with COVID-19. 24 people are in the ICU, and 13 are intubated. At present, our 7-day moving average for new COVID-19 cases is 209 cases per day, noting that September started with a 7-day moving average of only 40 cases. I hope you also see how these concerning numbers support some of the important actions announced by the province last Friday. Since my last report to you, we have received reports of 1,540 new cases. Again, a total of 23,338 cases have been reported since the start of the pandemic. Almost 30% of those cases have been reported since the beginning of September. Over a quarter of all cases were reported in the last 30 days, and more than 15% of all cases were reported in the last 2 weeks. I believe that these numbers can be reduced and the direction they move in reversed. But as I said, I hope these numbers illustrate the need for the temporary actions announced on Friday. I know that there is frustration and hardship associated with the decisions. My recommendations were based on the belief that we need to act in ways that interrupt the chain of transmission, ways that protect the largest number of people in the shortest amount of time. Based on the findings that we had access to here in Toronto and elsewhere in Canada, we sought the province's support for selective restrictions over a 4-week period. In our city, we saw 21 cases linked to adult recreational hockey in early October. In late September, we saw 18 cases linked to a fitness center with a potential 76 contacts. In Hamilton, nearly 70 cases are linked to 1 week at a spin class facility, and public health officials there feared 100 more people may have been exposed. Earlier in the summer, at least 40 infections were linked to a fitness center in Calgary. And remember that for every confirmed case, there are likely more cases that aren't severe enough to create worrisome symptoms, and some that don't give rise to symptoms at all. So those people are moving about the community, spreading infection without realizing it, and also spreading infection that may not be mild or moderate in other people. In a situation like that, public health concludes the course of action is to limit the opportunity for the virus to spread. We must act in the overall best interest of the largest number of people in the quickest amount of time. We are at a stage now where we felt the temporary restrictions could do that. We are asking a lot of many people who are affected by this through no fault of their own. The rest of us must repay that sacrifice by making choices that limit spread. I know these actions can help us return to a state of lower risk to health and the economy. With your active support and your determination to pitch in every day by choosing to act in ways that make it harder for COVID-19 to spread rather than easier. In my role as Medical Officer of Health, I try to tell you as much as possible not what to think, but what to think about. One of the places I think a great deal about these days is long-term care, where many of our most vulnerable seniors live. We are starting to see signs of rising infections in some of these settings. Currently, there are 14 outbreaks in long-term care homes in Toronto. To be clear, that's 14 out of about 100 long-term care homes. And even one single case of COVID-19 in a resident or staff is investigated as a potential outbreak in the home. As I've said before, the word outbreak is a technical term we use in public health. It doesn't necessarily indicate widespread infection that the word suggests in everyday language. I believe that long-term care homes in Toronto are acutely aware of the infection risk to residents. But we know that at the same time, the virus is hard at work trying to spread. So I think in the current environment, it is very important for people to think about the risk you might represent as a visitor to long-term care and ask you to think about how best to limit that risk. I am 100% supportive of in-person visits to seniors. These visits are emotionally important for everyone. What I would urge you to consider is the lowest risk way to connect with or see your senior. I ask you to think about ways that best protects them and the people they live with. One thing I've heard is a family creating a rotation of sorts, where one family member is the designated in-person visitor who facilitates virtual connections with other people in the family so that there's a shared experience. There will be many ways to create lower risk contacts, ways that best suit your family or your loved one. I ask you to find the way to most safely spend time in person with anyone you love who lives in long-term care. There are so many asks these days. I often wonder when we last asked so much of so many people at once and for so long. But we must ask a lot of ourselves and each other so that we move through the pandemic in ways that limit the costs and loss and suffering created by COVID-19. We are entering a new phase in the pandemic. Winter is coming with all the risks that being indoors brings with it. Cold and flu season come with winter, creating further complications and risks to manage. We're beginning to hear more about vaccines as Phase 3 clinical trials continue. As difficult as today's numbers are, we are entering a new phase. One that means that we are one step closer to a return to life as we would like to live it. One thing that has not changed is that we must rise to meet the challenge of minimizing COVID-19 in the meantime. With that, I'll now turn it over to Chief Pegg for his remarks.
Good afternoon. Thank you, Dr. Davila. Throughout our response to COVID-19, we've never wavered from our overarching goal of saving lives and preventing our healthcare system from becoming overwhelmed. We've had to make difficult and often unpopular decisions, but in doing so, thousands of lives have been saved as a direct result of the sacrifices made by each and every resident and by each and every business owner in our city. As you know, in response to both the provincial changes announced on October 9th and the recommendations from our Medical Officer of Health, we've had to adjust a number of recreation programs to help stop the spread of COVID-19. Our Parks, Forestry and Recreation staff have been working with Toronto Public Health to review the city's current recreation programs and specifically those programs that are deemed high risk for COVID-19 transmission. This includes programs being held indoors, where the physical nature of the activity results in close contact and where masks cannot be worn. Effective the morning of Saturday, October 10th, a number of our recreation programs and services have been suspended, including registered and instructional programs. These include Learn to Skate and Swim programs, dance, group fitness, and wellness programs, team sports with gameplay or scrimmages, and indoor permits for social gatherings. Fitness centers and drop-in sports programs are also suspended. Permits for indoor and outdoor sports have been adjusted to allow for training only, with capacity restrictions. Over the course of the weekend, our Parks, Forestry and Recreation staff have been working tirelessly to contact affected registered participants and permit holders, and will continue to contact registered clients ahead of their next program date. Refunds will be issued automatically over the next few weeks. Residents do not need to request a refund. It will happen automatically. Questions can be directed to PFR Customer Service at toronto.ca. That's PFR Customer Service at toronto.ca, or by calling 416-396-7378. The City will continue to operate the following programs with capacity restrictions and other health measures in place, including leisure swim and skate, lane swimming, arts and general interest instruction, after-school recreation care, December camps for children, drop-in youth programs that do not include sports, and both indoor and outdoor permits for training with no gameplay or spectators. In response to the challenges associated with COVID-19, we continue to evolve our program delivery to ensure they are in line with public health advice. With regards to recreation programs, City staff are working to adapt recreational activities that could be offered outdoors where possible, and to ensure that residents across the city are aware of existing outdoor opportunities. The majority of city services continue for residents and businesses in Toronto. All the city's outdoor amenities in parks and green spaces, such as sports fields, skate parks, trails, BMX parks, tennis courts, basketball courts, outdoor fitness equipment, picnic shelters, and playgrounds remain open. We have worked hard to ensure that our city services are well positioned to continue during this period of COVID-19 resurgence. I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto, including an overview of recent recreation service impacts. Thank you.
Thank you very much, Chief. We have a number of staff on the line today. If reporters have specific questions, we can get some more detailed answers if you like. First up is Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thank you very much, and hope everybody had a great and safe Thanksgiving weekend. Dr. Davila, we had an expert from Mayo Clinic in Minnesota tell us that, according to their research, while measures and restrictions are certainly necessary, the virus appears to be mutating, where one strain is much more infectious than the other. If that's confirmed in Canada, how does that affect the way you combat the virus? Does this mean changing how to advise people how to self-isolate, maybe more at home versus a hospital? Will labs be able to identify different strains? I'm just trying to get an idea of how a mutation affects how you would handle this.
So, Lucas, those are very good questions. And again, it highlights some of the learnings that we continue to have as we deal with this very new virus. So viruses do mutate. I'm not surprised to hear about that. And the question is, how does the mutation, I should say, manifest itself? So one method is for sure for things to become more infectious. Other mutations actually take the virus in the opposite direction. So I think really what we do within public health is to continually assess our data, look at the circumstances that are in front of us. That involves clear partnership and work with our laboratory partners. They're the ones that actually do the more specific testing around the genetics of the virus and can inform us around what they're seeing specifically if there are mutations and what the nature of those mutations look like. But fundamentally, it is a practice that we have been engaged in throughout the entire pandemic. Understanding what we see locally, what are our data telling us, what are our testing regimes telling us, what do we see in other communities, those nearby in other parts of Canada and those around the world. And we inform our actions premised on what we see, both laboratory and the actual experience on the ground. So you'll see us constantly changing our course depending on what we see play out in front of us.
And Doctor, on a much more basic level, we had a colleague get the notification on the app to go get tested and was told because they couldn't pinpoint the exposure exactly, even with the negative test, self-isolate for 14 days. But in follow-up with Toronto Public Health, he was told, if you're negative, you're good to go. I even had a situation where I was told at point of care about what to do with my daughter vis-a-vis going to school, and Toronto Public Health said something completely different afterwards. So I guess my question is, are these just anecdotes to you, or would you say that you have been hearing about a problem, either minor or major, where advice from point of care is very different from the follow-up with Toronto Public Health based on the same facts? Have you been hearing that a lot, especially this late in the pandemic?
No, so actually, Lucas, I have not been hearing that directly myself, but I thank you for bringing that to my attention. Very happy to discuss that offline, recognizing that, what we get from individuals as we talk through the situations may not always be exactly the same story. But I'm certainly happy to follow that up with my team to understand, are these situations arising and how might we actually address that?
Okay, thanks. We go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Mayor Tory, this morning the city manager was laying out his report for renewal and recovery for the city, and he indicated that the city is facing of between 1.5 and 1.7 billion dollars in revenue loss and costs next year, and that also that the federal and provincial government would be required to help the city offset those, well, really that pain. He also did indicate that there have been no conversations had yet about securing that funding. And I'm just wondering, you know, I know you just went through this hard process to secure that for this year, but when do you sort of foresee that you'll be going back to them asking for that support?
I actually have begun those discussions. I've spoken to the Prime Minister, the Deputy Prime Minister, and Finance Minister, the GTA members of Parliament in the Liberal government, all of those people, and then some, to indicate that there would be necessary a recovery and restart 2.0, as it were, for 2021, a program that's similar. And I've indicated to them our expectation that the need for Toronto, and I think the same is going to be true of other cities, will be less because hopefully transit ridership and other kinds of things will recover as the city itself continues to recover, but that there will be a program needed. And so I guess in that sense, I realize that they're just getting all the T's crossed and the I's dotted for this year's program and getting the money out the door into our hands and the hands of other cities across Canada. So I've been kind of leaving them to do that, but I've clearly had discussions with them about the fact there will be a program needed for next year as we are well into our budget process for next year. Thank
you. And Dr. Davila, I know they've done this in Durham and that there are some professors from Ryerson actually studying this as well, and there is also Ottawa that is testing the sewage. I'm just wondering, for COVID testing, if the city is looking to Ryerson for their results or if it is considering doing similar testing here on its own.
So, Matt, we are participating in those studies. These are still research endeavors around wastewater testing for COVID-19. I assume that's what you're talking about. And we are actively participating in those research endeavors and engaging with the researchers on their findings.
Okay, thank you very much. We go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you, Mayor Tory. Back to the city manager's report this morning. Obviously, there are quite a few recommendations that come with the report. Just need to know, and I guess it's a question for both of you, in terms of looking at those recommendations and what has started, what still needs to come, what stands out to you the most, and how best to begin tackling some of these problems.
Well, the two things that are most closely linked, in my view, and are of paramount importance are the need for us to continue and build upon some of the things we have done, to help advance the interests of those who are more marginalized and those who are more vulnerable to things like COVID-19, but not limited to that. And these were problems we faced before, but I think they've been presented in even more stark reality during the course of the pandemic. And so I think we're going to have to find ways to increase our efforts and our results in this regard. And the second point that goes with that is we cannot do this alone. Even a city as big as Toronto, the biggest city in the country, 20% of the GDP of the country, et cetera, we do not have access to the resources to be able to tackle affordable housing, tackle mental health and addiction on our own, nor should we be. We're hostages to an archaic system set up in 1867, but it's the best one we've got. And rather than open up the Constitution, I think we simply have to work together as governments to find ways to better allocate resources to address these problems, starting with the most vulnerable people. And so, to me, those are two things among many that come out of what is a very thorough report prepared to help guide us in the aftermath of the pandemic.
I don't know if Dr. Davila, sorry, this isn't necessarily a follow-up, but I posed the question to both of you. I know that a number of the recommendations are specific to Toronto Public Health. I'm wondering if you can address them as well.
So thanks, Mark. We have had the opportunity to look at those recommendations that are specific to public health and are eager and keen to move forward with respect to the recovery and rebuild work that's necessary, after COVID-19.
Follow up, Mark? Go ahead, Mark.
We're
Do you have a
entering a
follow-up?
new phase. Yes, can you hear me?
Yes, we can now. Sorry about that. Go ahead.
No problem. Another question for Dr. Davila. You had said we are entering a new phase, referring to the winter months and what's to come. But you immediately said thereafter we're one step closer to perhaps moving past this phase as well. I'm wondering if you can clarify that.
Well, you know, Mark, I think we have to look for sources of hope where they exist. You know, it has been a very, very challenging time, very, very challenging year, I think, for many of us, including those of us who work in public health. I'm looking forward, seeing hope in particular, as we see developments on the vaccine front. And, you know, I think it is a cautious optimism, but an optimism nonetheless. And I hope it's one that the residents of this city share with me and with others in public health practice.
Okay, thank you. We go next to Mark Douglas from 680 News. Mark, go ahead, please.
Thanks, Brad. A question for Mayor Tory first. Premier Doug Ford today seemed to be a little cold, perhaps even unsympathetic, for the recent TTC tweet about the looming problem of impossible physical distancing on crowded vehicles. In fact, the Premier pointed out how hard he himself has fought to get Toronto already $400 million for funding for transit support during the pandemic. So, Mayor, my question is, do you believe that more funding specifically for transit to come either from Queen's Park or Ottawa, both, is still a feasible expectation here? And would more transit funding really be the best solution to an overcrowding problem on the TTC?
Well, ultimately, the funding of the operations of our transit system and the funding of the capital requirements of our transit system, and I should say on the capital side, both governments have been supportive of Toronto's transit system over time, especially in the time that I've been mayor. On the operating side, I will concede, because I fought alongside him and fought with everybody. But I didn't want to say I fight with everybody. I fought on behalf of the city with all the different parties involved to get the transit money that was put forward by the federal and provincial governments. And so, yes, he deserves credit for that, as does the federal government. But here's the problem. The money that was supplied in that instance, yes, helped to offset revenues that had already been lost by decreased ridership. It didn't arrive in time for us to buy a whole bunch of new buses, for example, if we wanted to augment the bus service that is presently experiencing some crowding that goes beyond the ability to physically distance. We have taken steps, you know, as a city, as a TTC, to allocate extra buses to many of the lines, Keele, Lawrence, Markham Road, and others, Jane, Steeles. We've added extra buses there, but there comes a point in time when you don't have any more buses unless you take them off routes and reduce service for other people. So we're trying very hard to achieve a balance that requires you to take into account existing service all over the city, the particular needs of communities that have a stronger propensity to use the bus, which we have done by allocating additional buses, the financial consequences of all of this, because every time that you do something, there's going to be a cost to it, because right now we're operating 95% level of service for 50% of the ridership. 92% of the buses that are on the road today are carrying 25 people or fewer, which is about half capacity in the bus. But the reason we brought in the compulsory face covering rules on the TTC some months ago was because we said there would come a point in time as ridership hopefully grew back to closer to normal levels, which, by the way, they haven't really that much as yet. I think the overall ridership is running at about 37% now, but as that continued to grow, we would have a greater difficulty, a greater challenge in maintaining physical distancing. So we're doing the best we can. We're looking every day at ways in which we can do more and do better. And look, operating funding coming from either of those two governments has been a crusade that the City of Toronto has been on for probably 30 years, since it was taken away by the provincial government of the day. And it would be something that is done in many other countries. It would be very welcome, but for the moment, I don't want to seem ungrateful for the help that has been extended to us, because it's considerable, and Premier Ford helped a lot with that, as did Chrystia Freeland, the Deputy Prime Minister, and let's do this one step at a time. That money, if we had it today, wouldn't be in our hands in time to buy buses, which is what we're really short of at the moment, is buses to actually add them beyond what we've already added to those routes.
Thank you. And then, Mayor, for another question for yourself or Dr. Davila about the TTC, can either of you offer any kind of a more comforting reassurance or a comforting word of guidance to all the people in this city who are dependent on transit to get around? They can only ride the bus or the subways.
Well, I will
beyond
start.
suggest-
Sorry, Mark, go ahead.
What?
I will start.
Sorry. Just what? Can everyone hear me? Okay.
Yep, that's my fault.
Okay. Thank you. Thank you. That's all right. Let me just start that question over. I'm wondering if either Mayor Tory, yourself, or Dr. Davila can offer anything that's more comforting or more reassuring to people who are dependent on riding these crowded bus lines. Is there anything more reassuring you can suggest to these people other than please wait for the next bus if you think this one coming up is too crowded? That seemed to be the best message that we got out of Queen's Park today in terms of advice.
Well, I said earlier this morning, and I believe it to be so, that the way in which that particular message was conveyed was insensitive and not the best way in which we can communicate to people who are concerned about this. I will say, as the non-doctor here, as the elected representative, that measures have been undertaken, substantial numbers of measures by the TTC to disinfect vehicles, disinfect platforms, to add extra buses where there's indications based on actual counts done by technology that tells us how many people are on buses, add as many buses as we possibly can to alleviate that. And just to say, though, that in the end, there are going to be places as ridership comes back up to normal where it just isn't going to be possible for us to keep physical distancing on every vehicle, although it will be the case on many, and to say that we're making every effort to do so for as many places as we can, and that you know, we are reallocating extra buses and taking all these different kinds of measures, and we're reviewing it all the time.
I think I would just add to that while the mayor is quite right, he is a non-doctor, but he is certainly becoming a bit of a public health expert in his own right, having been at this table and having had many conversations with us. I would just echo the fact that, yes, Toronto Public Health continues to work with our colleagues at the TTC, and we continue to provide advice on how best we can strike this balance. And I think this is what the mayor was getting at. A number of measures have already been taken, and it's a question of trying to find that balance as we try to find balance, you know, not just on the TTC, but in life writ large, managing COVID-19 risks, and at the same time ensuring that access to services and transportation, including public transit, is available for use by those in our public who need to use it. It's a balance we're continuing to work on, and we will continue to work on throughout the rest of this pandemic.
Okay, thank you. We'll go next to Dave Woodward from Global News Radio. Dave, go ahead, please.
Thank you very much. Mayor Tory, 170 TTC workers are still laid off, and I know you've made the point that not all of them are bus drivers, but wouldn't bringing back those workers help the overall operation and in that way help with overcrowding?
Well, we have to rely on the judgment and the practical application of the facts by the Chief Executive Officer of the TTC, which I know he's dealing with this each and every day. And he said that a full complement of employees will indeed be brought back when we hit 50% ridership. We're now at about 37, but I know he's also shown that he's prepared to be flexible in that regard if he thinks it's going to help. But a point that you alluded to, which I must make here, is that when people are brought back, of those who are still on layoff, and it's a number that you cited, 175 out of, I think, 13,000 transit employees, they will be brought back not based on what they do, in other words, bus driver versus subway driver versus mechanic versus whatever. They'll be brought back on the basis of seniority. And so if what we need is bus drivers, it isn't the case necessarily that bringing back certain numbers of those people will produce bus drivers. And then you confront the other problem we have, which is there aren't a lot of buses in the garage. In fact, they're next to the ones that are set aside for the emergency circumstances so that we can instantly start shuttle buses when a subway has an incident. There are not buses to be driven by those people. And so we have a number of different challenges in trying to do this, and I think Dr. Davila put it very well a moment ago, which is to say that we are sitting and looking at the balances of all different kinds, the balances between making sure we can provide as much physical distancing on vehicles and less crowding as possible, the balance between that and the financial consequences of that, because the other governments, while they've helped a lot, have not given us a blank check just to say, sure, anything you do, you know, we'll pay for it. And the paramount need, obviously, for us to get people to and from where they want to go as safely and in as good health as possible, and we're taking a bunch of measures to do that. So I know it's being looked at each and every day. This is not something that's looked at once a month or once in a while when it comes up in the news. We're talking about it every day. We're doing the very best we can. We will try to continue to do better, and we will try to be sensitive in terms of how we communicate at the fact that we're having to achieve this balancing act, as we're having to do in many other areas. It's very, very difficult. You wish we could give people all good news all the time and tell them everything they want, but in the jobs that, certainly the job I have, that's not always possible.
And a second question, a different question for Dr. Davila. It was about 10 days ago, I think, that you asked the province to enact certain restricting measures like shutting down indoor dining as well as group classes at fitness centers. But the province went beyond that and shut down gyms altogether. In your opinion, is that an overreach? Is that too much?
So when I think about what the province did and the actions that they took, I think that they were following the advice that they heard from their advisors, including those who sit on the public health measures table, the scientific tables. There are many experts that I understand are informing their decisions. And effectively, the way I see it is that they took the decisions that were premised on the data locally, and by locally I mean around the province, various jurisdictions around the province, but also data that was seen from around the world. And, you know, the short version of the story is that we know that there are certain environments that give rise to increased risk of COVID-19 transmission. You know, closed indoor environments where there's plenty of close contact and congregating between individuals, particularly in those circumstances where it's either impossible or difficult to wear a mask, given the nature of the activity. So eating and drinking are activities for which it's impossible to wear a mask the entire time. And as well, situations where physical distancing may be more difficult or challenging to maintain. So my understanding is that that's the kind of thing they were looking at as they took their decisions. And I'm hopeful that the actions that they've taken will have the impact that we wish it to have on transmission rates here in our city and in the other places that were impacted by those decisions.
Okay, thank you. We go next to Chris Glover from the CBC. Chris, go ahead, please.
Hi there, Mr. Mayor. I want to get back to the city manager's report. When we talk about a figure like $1.5 to $1.7 billion and a COVID shortfall, can we get an updated assessment from you? I know previously back in May you were saying that service cuts could be devastating for Toronto, but at this point, in terms of how much specifically you're asking for from other levels of government and how bad the service cuts may be if they don't come through, and then any timeline you can provide too.
Well, we're at such an early stage, relatively speaking, in the budget process and in an early stage of our discussions with the other governments about whether they can come forward, as I hope they will, with a sort of recovery and restart 2.0 for 2021. So I wouldn't want to start speculating on that. I can tell you what my objective is, and that is shared by Councillor Crawford, the budget chief, and by the city manager, I'm sure, which is to come forward with a budget that has to be balanced, so we have to do that. That does not involve cuts to services, and in fact looks for areas in which, coming out of things like the report released today, can provide more help to people who are vulnerable, and we will have to do that in partnership with the other governments. That was always the case. That's even more so the case now, and the need is greater now. So we're going to start from the premise that we're going to try and achieve all of that with their help, and we'll see how it goes. But I'm not going to start, outlining what cuts we could contemplate if that didn't happen. Let's be optimistic about this, and as we have done in previous years, albeit that the problem is bigger this year, that we can resolve these problems with a lot of cooperation and goodwill.
Okay, fair enough. Thank you. And Dr. Davila, what do you think of the Great Barrington Declaration? And do you specifically think it's causing confusion and mistrust of accepted guidelines when it comes to dealing with the pandemic?
So, I admit I have not done a thorough review of that particular document, but what I can tell the people of Toronto is that, I ask them to consider what we've put forward to them, that, we do our very, very best here at Toronto Public Health, and certainly I've seen that from my other public health colleagues all around the province and throughout this country, to provide the best information to help people make decisions around their lives and their activities and what they wish to do in their day-to-day lives and activities. So, I realize that there are many different perspectives that exist. People have different approaches and different opinions. However, I think when we look at science and the practice of science and the practice of public health science, on balance, we look at the totality of the evidence, and that is exactly what we're providing at Toronto Public Health and through the other public health agencies that we partner with, Public Health Ontario, our colleagues at the province and our colleagues federally. We're seeking to provide the best scientific advice, and we hope that people listen to us, that we've earned their trust, and that they continue to put their trust in us, that we will do the very best we can to provide them the most accurate and most up-to-date information so that they can make good choices for themselves and their families.
Okay, we go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Good afternoon. My question is for Dr. Davila. Dr. Davila, last week you said that the reproductive rate in Toronto, according to Toronto Public Health, was at 1.2. And I'm wondering if it's still at 1.2 and whether it's realistic to think that we can bring it back down to 0.9, which we last saw, I think, in July.
So, Francine, we're just updating our numbers today, and my colleagues advised me that our new reproductive number now is at 1.0. So we're hopeful that the actions that have been taken by the province will have the desired impact on reducing the risk of transmission of COVID-19 and ultimately that impact on the reproductive number.
Fantastic. So, and then the second question is, every now and again we see people on social media arguing that lockdowns don't work, they just postpone the inevitable. How do you respond to people who hold that opinion, that lockdowns don't work, that they just delay the inevitable?
Well, I think that when we look on balance at what other jurisdictions have done and what our evidence tells us, what our own experience here in Toronto has told us, we're learning more. We understand more about virus transmission than we did earlier this year. And, effectively what we're trying to do is take those lessons learned, take our experiences and apply them as best as possible to strike this balance. You've heard me speak quite a bit about this balance around managing COVID-19 risks, the direct risks that COVID-19 places on our health as a community, but as well trying to balance the other aspects of life and the risks associated with control measures and the restrictions that have been put into place. So we've tried to, this time around, advocate for measures that are as focused and targeted as possible. And this is, in fact, the practice that has been adopted by most other countries around the world, most other jurisdictions around the world with the best available evidence. So, it's my hope that people appreciate that and that we continue to work on this to try to achieve the balance as best as we can.
Okay, thank you. Final question is to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
I will be very quick. I just have one question because I know we're getting long in the day here. There's been some concern about the province not providing evidence behind the new measures that they've imposed. Your counterpart in Ottawa, Mayor Jim Watson, told Local Talk Radio yesterday he was supporting a motion calling on the province to reconsider the 28-day lockdown and express support for a petition circulating in the city demanding the province produce the data that justifies the new restrictions. How do you respond to this, and would you support a similar movement if it were to emerge here in Toronto?
I'll say
this is for the mayor. I'm sorry.
I'll say two things. First of all, the GTHA mayors yesterday indicated their hope that there will be, as I'm sure there is, a continuous review of all the data and the evidence of what's going on during the closed down period so that we can see what impact it is having on the health situation, which of course was the basis upon which this was done. But, I supported and do support our medical officer of health in making that recommendation, and I support the Premier in accepting that recommendation and more that came from his own health table. The second comment I want to make is this. I believe that the provincial system, which has a health table where you're not really sure who's there, it has advice that is conveyed confidentially to the medical officer of health, who in turn goes to the provincial cabinet, which meets in confidence, is too opaque. I think the system that works here at City Hall on many different fronts in terms of the whole way in which civic government is operated is more transparent, which I think is consistent with the kinds of approaches we like to see taken in 2021. But I understand that the province is operating under a system, certainly when it comes to cabinet confidentiality, that is not of their own making. But I think we could make much less obscure and much more transparent the whole system that involves this health table, at which we're represented, by the way, the health table and how that advice gets conveyed back and forth and who conveys it and some idea, at least, of the substance of it. That's my view, but it's only one person's opinion.
All right, everybody, thank you so much for joining us today. That concludes today's briefing. Please have a safe and pleasant evening.